right. So this has to do with people who are still having a hard time capturing patients for myopia control treatment. And we have two questions. The first one being, do you have a system in place to follow up on myopia control candidates?
Yes, I do, and everybody should. I think this particular question is discussing when this doctor makes a recommendation for a child to undergo some myopia control treatment.
Hmm.
They may not be converting. So we're talking about lead conversion or converting a possible patient that needs this treatment. And I think it's important for everyone to have some type of outline of procedures they go through. So this is how it goes through in my practice. Is the first thing in the exam chair during the primary care exam, if myself or any of my doctors notice a child who is nearsighted who would benefit from a myopia control consultation, they'll recommend just that. They'll recommend a consultation. We don't recommend ortho-K or atropine or any other modality in the exam chair at the time of the primary care exam. Just like we wouldn't start treatment for glaucoma or any other treatment right in the chair. We have them come back for some type of evaluation or consultation. So that's the first tip, is
Okay.
that you have to realize that you're going to have to present this to quite a few parents before one takes it. And that's what I teach at Supercharge. I have found doing this for a number of years, I have to recommend it to 7 good candidates for one to transition into a consultation. So don't be discouraged. This
Hmm.
is something, even though it's been FDA approved for 20 years, it's new to parents. They have to be interested in some form of myopia control. So don't be discouraged. So the first step is have a consultation. And everybody's heard this before. Number 2, here's another key tidbit. Is most of my patients, I would say over 90% of my consultation, do not come from my exam chair. They come from friends and family. And Matt, we've talked about this in past podcasts.
Yep.
So the key is to make this event, if you will, this consultation worthy of discussion at the school, at the soccer field, amongst family gatherings, so that your parent can educate parents before they come in for the consultation. But let's say you don't have that luxury, because I've been doing this a long time, is now before the consultation, this is a key ingredient. I do a phone conference or virtual conference. This is new since COVID. We discussed this last time,
Right.
but it has helped me tremendously, because I think what this doctor's referring to is that when they have a candidate, they don't transition into their program. So what it starts is with a virtual call where I sit down and I talk with the parent virtually for about 15, 20 minutes. I call this a parent conference. And I
Hmm.
schedule it using Google Meet or Zoom. And we talk about things you don't have time to discuss in the exam room. Is your child on a computer a lot? Are they learning remotely? Do they watch a lot of YouTube? What do they do on their downtime? Do they like to read? Do they play outside? Are siblings nearsighted? Are parents nearsighted? What age did the parents become nearsighted? We even go to the grandparents. And then I have a nice history prior to the child entering the consultation. And if I could tell you right there, that's such a huge tidbit that I've invested in since COVID began, and I'm going to keep it long after this
Hmm.
pandemic is over. So
So
then when the
what
child
kind
comes
of,
in, I'm
sorry,
sorry, go ahead.
as soon as you mention the family history, because you're definitely not the first doctor that I've heard does this. Carrie does this. It's very
Wow,
important. I'm sorry to interrupt, but
no.
why is that so valuable? Because I feel like what you just said is very important to get that family history, because Carrie covers with a patient like their nutrition habits and all sorts of details. He asks you lots of questions. So I don't want to skip over that part, because family history is super important. So why is it so important?
And lots of questions is very important. I have found that parents who are interested in myopia control have a lot of questions.
Hmm.
And during our exam time, our 20-minute allotment, half an hour, 15-minute allotment during an exam, you don't have time to address these questions or ask these questions. So family history is critically important for a number of reasons. One is we know that myopia progression has at least a genetic component. We could all agree upon that. We could say
Hmm.
there's a multitude of factors. Nutrition is very interesting because I talk about that as well. Basic nutrition, because these poor kids are learning virtually now. They
Hmm.
may start at 8:45 and go straight to 1 o'clock with minimal breaks. And I ask the parents, do they have a glass of water, hot tea, a snack next to them? And a lot of times these kids are dehydrated, let
Right.
alone basic nutrition. And these are questions that Kerry obviously asks, and many of us ask, but are
Hmm.
critically important and during these times where many of the kids are still quarantined, they're at home glued to their computer. The family history also is important because there's a certain level of guilt involved. When a parent is myopic, they're hoping that they haven't given this gene or or their environment to their children to cause them to be nearsighted. So there's a big difference between a parent who started wearing glasses in college and now
Hmm.
are -4 myope, as opposed to the parent that started in first or second grade and now is a -10 or -12 myope.
Right.
And that, see, this is so critically important because during my consultation now, I really know how aggressive I have to be. I know the age of the student. I know approximately their refractive error, and I know how strong of a family history there is. I also know their environment. Many of these kids haven't gone outside in 6 months. Some kids have, and they still
Hmm.
progress in myopia. So these are all factors that are so important. I got them out of the way. So when this child comes in, who's usually between 10 and 12 years old, I can fully concentrate on their experience, not on getting a history.